Dr. DeRionne Pollard, the proud president of Montgomery College. I'm delighted to welcome you here today to this Facebook Live session. Absolutely delighted because we're hosting a series of conversations with community leaders and our elected officials about workplace issues, the workforce that we're trying to have for Montgomery County, and more importantly, thinking about the unique role that Montgomery College plays in this ecosystem. I am pleased today to welcome my friend, but also our wonderful council member, one of our newest council members here, but you no longer get to say that. Now,
That's right.
year. We have Councilmember Gabe Albornoz, who's also chair of the Health and Human Services Committee. He clearly has a very powerful voice and role in helping to shape the workforce, particularly as it relates to issues in the health sciences and those careers that are very much needed right now as we think about the economy of Montgomery County. You can come to our phenomenal state-of-the-art health sciences building here on our Tacoma Park Silver Spring campus, where you can study to become an RN, a surgical technologist, a physical therapist, assistant, any of the types of fields that you can see here in a facility that was designed specifically for that. You'll see behind us some of the wonderful simulation spaces we have, and I encourage you, if you're thinking about a career in the health sciences, as so many of our students are, you want to come down here and be a part of this wonderful space and understand the programs, the rigor and demand, but also what wonderful careers await for you after the program. This facility is home to our primary care clinic operated by Holy Cross Hospital, which is also on our campus here. We also have their hospital, which we host on our Germantown campus in Montgomery College as well. So we know that partnerships like these are truly beneficial because they allow us to have a more powerful impact in the communities that we serve and allow us to meet the needs both of our business community but also that of the college and the students and community that we serve. So I thought this location was the perfect to bring our Health and Human Services chair here. He's taking a tour, understanding more about our facility, but he has a very intimate understanding of Montgomery College, which we'll come back to a little bit later. Yes. So my first question to you is that here at Montgomery College, we work very hard to engage our business community, to talk about the needs of Montgomery County, but we also talk about technology and how technology is affecting the workforce. When you think about the things you see and hear, having seen parts of this facility, what do you think about in terms of how technology is really redefining and reshaping how one thinks about workforce education and, more importantly, the work of the future?
Well, first of all, this is a magnificent facility. It's my second time here, but first time as a council member, and I just have such an unbelievable appreciation for not just the technology, but the incredible faculty and staff and students that make this place run. And as I look around this magnificent room and as you visit the various components of this facility, it is the perfect location and backdrop for this conversation because we've been hearing over and over again from our business community that they need employees that understand technology, embrace it, are not afraid by it, but also are willing to learn along with it because technology is very much a moving target, and in the healthcare space is the future. It will open up opportunities for telemedicine. It will ensure that we have greater access for residents across the entire county, particularly those that are in more vulnerable positions or live in parts of the community that don't have as great as access as places like this. And I also want to stress, Dr. Pollard, that the partnerships that Montgomery College has been able to forge with Holy Cross and so many other institutions are critically important as well, because students are not just learning through the education and rigor and class structure, but they're learning in real time through these partner organizations and learning and helping to identify those jobs that are necessary right now. So the technology and this facility is a marriage made in heaven, in my opinion.
Well, and this facility is in large part comes from strong support from our county that invests in us as a program operationally, but also in our capital budget, as well as the state when they recognize this. And then we have phenomenal faculty and staff, as you alluded to, and administrator leadership here that goes out and seeks additional grants so that we're very supportive of what those needs are and thinking about how we can help allay some of the concerns that exist in the space about how we're going to create these future healthcare professionals, while at the same time knowing that those programs cost money. These are some of the most expensive programs we deliver, but I'd like to think the fact that we're talking about lives and helping to save lives and helping people be prepared for that is truly important.
Well, it is, and you know, we have such growing diverse needs here in the county. Our fastest growing demographic is actually our aging population.
Yes.
And today, about 9% of our population is over the age of 65. That's going to exceed over 22% over the next 16 years. Wow. Warren Buffett was on some show last year, and they asked him, what should people be investing in? And he said, anything relating to aging. Because we, as a society and as a community, have to have the infrastructure in place to take care of our most vulnerable residents, especially our seniors. And so that's why programs like this nursing program and facilities like this are even more important than they have been in the past. And quite frankly, with poor decisions that have been made at the federal level regarding immigration,
yes.
We're going to have to grow many of the next wave of professionals right here in our community, and it's going to take facilities like this to make that happen.
Your point about seniors is so, because that's actually one of my next questions, to kind of talk about these vulnerable populations,
Yes.
emerging populations. What are business leaders telling you about how they're trying to prepare? Because I think your point is so important. One of the reasons that the case was made at the state level to put the new hospital, the first new hospital in, I think, 40 years in Montgomery County at the Germantown campus certainly speaks to the need within the county, but their number one issue is the aging population that we have in our community and how we need to keep them connected. Now, I know you've talked quite a bit to me about some ideas you have in that space. So twofold question.
Yes.
One is, what do you think employers are needing as they talk to you about these issues in terms of special and vulnerable populations or emerging ones?
Yep.
And then the second part of that, obviously, is this idea of how do we in the county start to respond more intentionally to these populations and making sure that no one is left behind?
Absolutely. So they, first of all, need more professionals, more people who have the background and education and experience necessary to fill a number of these vacant positions that currently exist. They also need staff that are culturally competent, that understand the unique, diverse needs of our residents, the fact that over 40% of our county residents are foreign born and speak English as a second language. That is an asset,
Yes,
but it also, we have to be prepared to really provide the services necessary for those populations. And in the medical space, that is particularly important. People are living to much older ages, which is such a blessing on so many different levels, but our healthcare system and our insurance structure is not structured to meet the needs of this growing population. And this obviously is a critical talking point on the presidential debate level right now, and local jurisdictions are going to have to continue to wrestle with and provide the support that we can in partnership with the state, in partnership with our private community, private sector, in order to be able to expand programs and services for seniors. So, and many other populations as well. So I think that those things combined are what really are going to make a difference.
You know, one of the things, and I've heard you say this, and it's to me very powerful, this idea of how we need to look at multiple county services coming together to meet needs. I've heard you talk about child care and senior care together. I've heard you talk about ways in which the college might be useful in that. You want to talk a little bit about that?
Absolutely. So one of the greatest things that I've learned in this first year as a council member, and you sort of knew this intuitively, but you can see it on the front lines, is that all these issues are connected. Education, workforce development, housing, transportation, they're all connected. And so when we can more intentionally connect dots within workforce development, but then also to meet the growing health and human service needs of our county residents, then everybody wins. And a good example of that is multi-generational programming. We have tremendous childcare issues that are not being met across the country, but here in our county as well. And we have this growing aging population. And so you have organizations that are trying to fulfill both of those needs, but that, in my opinion, creates opportunities for us to build more multi-generational programming so that we're addressing the needs of two very vulnerable populations at the same time.
You know, it's interesting. I was sitting here, it just dawned on me, we're probably one of the few places in the county where, for us, in terms of our workforce, we potentially have 4 generations in the workforce, but when we also add our students to that, we're one of the unique spaces where we have to think, and could also be an experimental site about what these things might actually look like.
Right.
Both for our students who are traditionally aged and non-traditionally aged. When we look at our day camps where we have you know, elementary, middle school kids here, as well as seniors in our lifelong learning institute. So there's a real incubator that we might be able to really help step into for the county to kind of explore some of these issues as you're talking about.
I would love to talk more about that. And the other thing is you were talking that struck me, and we make a good team.
Yes, we do.
Is that innovation.
Yes.
So while we're also teaching these important skills, the ideas for how to better serve our communities are going to come from the students that are here in this college and students in other universities and colleges across the country. And so we need to not just put them in the best position to succeed, but empower them to help teach us on how best to serve our communities.
One of the things I think that Montgomery College excels at, and one of the things that I think is going to be one of our defining competencies, and probably for any entity that's similar to us that is a mission-driven institution, is about how we build partnerships.
Yes.
And I've heard you talk a lot about this idea of how we need to expand capacity, because the pie isn't necessarily getting any bigger.
That's right.
But we've got to figure out how we take your little bit and my little bit and put it together to really have some impact. When you think about what employers might be telling you about this, what other nonprofit leaders may be saying about this idea of partnerships, what are some of your thoughts about how we might be more effective partners with each other? Not just simply saying that I need or want this from you, but how do we start to really have honest conversations about how we can be more effective in partnering to help expand capacity?
You know, some of that is at the 30,000 foot level. It's just building trust and building relationships and really getting to know people outside of your sphere of control. And one of the many things that I really appreciate about you, Dr. Pollard, is that you don't just stay in your lane. You are out and about in the community and meeting with people from Montgomery County Public Schools. You're meeting with businesses. You're meeting with a number of different key stakeholders, including policymakers, and you are a connector. I'm a connector. These students are going to be connectors. And so to the degree to which we can really enhance or reinforce those alliances and that trust and create that time and space for us to be having these conversations, that's when good things are really going to happen. I look at organizations like Montgomery Moving Forward, which is a great example of the public, private, and nonprofit sector leadership coming together to address issues like childcare and things like Leadership Montgomery. There are these touch points, these convening organizations, and frankly, to some degree, the county council, because we have all of the county's incredible government structure reporting to us for budget. We've working with the Park and Planning Commission on master plans for the county. And so it's being open to and being humble and being ready to learn from these partners. I think those things collectively working together is going to create an even better economic ecosystem here in Montgomery County.
You used a word that I am like trying to advance within the county, this word alliances.
Yes.
Because I'm actually becoming quite tired of the word partnership, because everybody's everybody's partner.
That's
you walk into a space, you're my partner, I'm your partner, we sing kumbaya with each other. But what are we really advancing in that? And that, I think, is what you capture here, is this idea of how do we begin to really drive an agenda that has an outcome that benefits the community and all of us, which is why you love MMF, this idea of social impact and collective impact. So you just made my heart happy when you just talked about it. I want to make sure I don't have any questions coming in before we go forward. No questions yet? Good. All right. So my next question. So I'm an English major. I'm in this beautiful STEM building, and I have some of the best faculty in the country who work here, and they are so dedicated to making sure that we produce the next generation of healthcare professionals. But one of the things I hear so much from employers is this idea that we need to hire people who can communicate, who are critical thinkers, who, as you said earlier, appreciate and understand cultural differences. I've been using this word of power skills, because you hear a lot of folks in the business space and others say soft skills, and I'm thinking there's nothing soft about being able to communicate, because if you can't do it, you can't talk to these little sim people if you aren't able to really use language in a way that is effective and so forth. So talk to me a little bit about your belief about how we look at power skills or foundational skills as really being this foundation for what the workforce environment needs. Are employers telling you that as well?
Oh, for sure.
Okay.
I think that, first of all, we never stop learning. In every scenario, in every situation, now in the council, I'm learning an entirely different skill set than I needed to be a successful director of the recreation department, than I needed to be a successful executive at a nonprofit organizations. And so that's sort of the fun part as you grow professionally. But we are hearing more and more from employers that they don't just want staff that reflect the diversities of the communities that they're trying to serve. They don't just want staff that understand the education and rigor. They want staff that know how to work in teams. They want staff that are thinking outside the box and creatively trying to address some of the challenges that are facing us today in our communities, because those challenges are very complex. And the manner in which we communicate with people is so different than it was when I started my professional career 20 years ago. First of all, there's so many different tools to communicate with people with, which is a productive and positive thing, but if not used effectively, could actually create more problems than we're trying to solve.
As well we see, right?
Yes. So I think that I love the power skills thought, because you're absolutely right. And it's like when I was in the youth development space, you can have all this training and know how to put a curriculum together, but unless you can connect to students, unless you can really authentically get through to them, then you can have the greatest curriculum in the world and it's not going to work.
So I'm going to go off script for a minute.
Yeah.
One of the things that I have observed, and this is, the county has had a major shift. We had new leadership who's come in. I think we talked about this morning at the county executive state of the county. We had a major shift in a new county executive for the first time in 12 years.
Yes.
We had new council members who've come in,
Right.
and now you're officially a year into this
Yeah.
and past, actually. What's been the biggest learning that you've had during this experience?
So I think, first of all, I love my job.
You were made for it.
It puts you in a position to impact both at a macro and micro level. The constituent issues. We were reached out, a woman who was fleeing domestic violence and had 3 children, who was on the verge of homelessness, reached out through a friend of our office, and our office worked with this unbelievable advocate named Grace Rivera Oven to address a really complex system that's out there. And I think what I've learned is that our systems are incredibly complex, even for people whom are in the best possible position to know how to navigate them. And I also have observed that entire industries who are connected are not really talking to each other. And so I think we have this very stove-type approach to so many things, and we have to break through that. One of my favorite things on the council is when we meet as a full body to discuss and tackle a specific issue, as opposed to doing it specifically through a committee. Because while that's important and you have to process this work in some way that makes sense, collectively as a body, we're much stronger than if we're just focusing on these issues through our specific areas of expertise. So I think that's been the biggest learning curve.
Uh-oh, I got a question coming in. Sorry, see, these people, I get to play Oprah, but I keep asking questions.
I love it.
Now, this question is, let me see where it is. This is for me. How does Montgomery College prepare their students for the NCLEX? So we actually have a robust program for this. The person on there who asked about this, we have several training programs in terms of study groups the students can participate, but it's first embedded into the curriculum. So one of the things I know for sure, we have phenomenal faculty at Montgomery College, but some of the best we have are in the nursing faculty, because they're very dedicated to looking at matching the curriculum that they have, and they're responsible for teaching. They do that very specifically through curriculum design. They have a series of workshops that they provide with supplemental work for students. And what's very important about this, they get constructive feedback along the way about how to adapt the curriculum where necessary, and then they work very deliberately to do that. We had this spring 2019, our graduation cohort was at 93%. So I don't know about you, that tells you that we're doing something right. So our faculty and the support services we have in this particular program excel at providing the support to students to get to the NCLEX, to be successful, and more importantly, to get a job, hopefully in Montgomery County, but to be highly successful in that space. And people just tell me they're proud of our nursing school, they're proud of the program. Y'all can keep on telling us that. I'll put that on. I'll tweet that out later.
I love it.
Make sure I'm checking my time. So here's my next question for you, and this is what's been the biggest surprise for you? Because I think stepping into this role, you were, a lot of people talk about the fact that you studied for this role. You were well prepared. You know this community. You've been deeply engaged in it in multiple ways in different areas. But I'm sure there had to have been something when you stepped into that job and you're like, oh, I didn't know that, or, oh, we do this way.
Right.
Yeah.
Well, I think the reliance and the connection between our federal government and our state agencies, particularly in the medical space. I've learned a lot more about Medicare and Medicaid over the last year than I had in my previous lifetime combined, because it is a very complex issue on a lot of different levels. And so I think just the sheer volume has been challenging to process and figure out how to address. And so we're trying to address issues one at a time as they come in to be able to fully provide support.
Well, one of the things someone just asked me is, can you, I'm assuming you or me, describe how MCPS, MC Early College works? So one of the things that we have at Montgomery College, first is a website you can go to on the college's website about early college, and also MCPS has a corollary one as well that talks about our program. We have early college programs. We also have called middle college programs. Some programs are offered directly in the high schools that our students, high schools that students are at, and they take Montgomery College courses there. And then we have students who come to the Montgomery College campus and take courses here, allowing a student to potentially graduate with both their high school diploma and their associate's degree from Montgomery College. It requires a tight coupling in terms of curriculum to look at what a student wants from the beginning to the end. There's an application process, an approval process that the high school has to go through, and then there's also a series of steps the students has to go through in terms of placement when they come to Montgomery College. Maybe this begs the question, we should do a Facebook Live session on middle college and early college, but I know that you've been a big supporter about this because you've talked about this idea of helping to build pathways, oftentimes for students who didn't imagine that they would be going to college, and for families, this actually can be a very economical decision for them. Thoughts
That's
you may
exactly
have about
right.
it?
Well, we have to take the long view. I mean, there are jobs open today, but we can't be overwhelmed by the lack of being able to fill those positions today and not also think about the future. And so partnerships with the Montgomery County Public Schools, I know Superintendent Jack Smith really gets this.
Yes.
He's been very open to figuring out how students can more effectively through Summer Rise and other initiatives have meaningful opportunities to learn more about professional development opportunities and the workforce that's out there, what jobs are available to them.
Yeah, I love that, Jack is superintendent, just phenomenal. And this idea he talks about is all means all.
Yes.
So we want to give college access opportunities to students who know they're going to college, students who never thought they could go to college, students who want to stay local and go to college, students who need to have a different experience. So I think that's a very powerful thing. He's really changed, I think, some of the conversation in the county around college access and what those partnerships can be.
Yeah, I've lived by the "we all succeed when we all succeed" mantra, for sure.
So someone just asked, is that a real patient on the bed?
Oh, that's funny.
So let me tell you, these are not real patients, but these are real faculty and staff and our nursing students who also work with us. But these are actually what we call simulation people. That's what, so I referred to them when I first came in. These are highly technical instructional aids that allow faculty members and their support staff to program them that allow these sim people to do different things. Sometimes they will present with certain illnesses. They actually have the ability to be programmed to speak and to do certain types of things. And we have them certainly representing folks at different stages of their life, from infants to aging populations, and they are powerful teaching tools. We invest in them thanks to our county and state and grant dollars to allow us to keep them current, because as we talked about earlier, the technology is constantly evolving, and this allows a student to have some experience with certain types of issues and phenomena before they step into a hospital where they're doing their practicums and very different types of experience with live patients. So these are very powerful. Did you get to see any of them yet?
I did. It threw me off a little bit. The first time I walked through the room, I thought, whoa.
I know. Are these real people, right? And then I love also the
impressive
diversity of them. You'll see, because we spend a lot of time in this program helping to prepare students for the patients that we have in Montgomery County now, and that's very powerful. This other question was, does the school offer an LPN program? And it kind of related, if I don't want to get a degree and just want to get a certification as a CNA, we do have CNA programming that you can go through, and it's primarily offered through our workforce development and continuing education area of the college, and you can go to our website and you can see our CNA programming. We don't offer LPN, if I'm correct, but we do have specialized areas to talk about how to help students get from the LPN, if you already have one, into RN. But more importantly, we know the credential that's needed right now for hospitals and most medical facilities minimally is the associate's degree, the ADN, and we work very closely also to help students move from the ADN to the BSN and so forth. So those are very potent degrees that allow people to enhance their quality of life. Oh boy, some more. What support can the MC nursing program get from county officials to facilitate the success of students in their program? Anything you want to say about that? I think you all do a lot in terms of helping us support financially, but are there other things you think that the county could do for us?
Well, I think leveraging more of the partnerships with our primary care providers and our hospitals.
Yes.
You know, the partnership with here at Holy Cross is really impressive. But the hospitals actually do a really good job of coordination amongst themselves, better than in many other jurisdictions.
Yes.
It's not really viewed as competition. They view each other as complementary to each other, which I think is so impressive. But I think contacting directly through those institutions would also be helpful.
That's very good. And I think I've got about 4 minutes left, 5. So I got some fun questions, okay?
I love it. Yeah.
Okay, so did you make any New Year's resolutions?
I did. I made a few.
Tell me.
So I have 4 kids.
How old are they?
11, 9, 6, and 3. So whom I love dearly.
Of course
And
you
this
do.
year I definitely want to be a little bit more present for them. Between the campaign and the first year in office, you know, wanted to be home for dinner more often
How
than
are
I
you doing
should.
that?
So we're going to build it into the schedule
There
moving
you go.
forward, because that's the best way to do it.
I have to tell you that has actually been a commitment of my own to be more present and
Yes.
to be there, and that means you have to actually put it in the schedule, because
That's
if you
exactly
don't do
right.
it, everybody will plan around it, and it's okay to say no sometimes.
That's exactly right.
All right.
Right.
What is your favorite soccer team?
Definitely the United States national team.
Yeah.
So and DC United as well,
Yes.
and the University of Maryland. But I love Montgomery College's soccer team
There
too.
you go, there you go.
Because there's definitely a connection there. My dad actually played on Montgomery College's first ever soccer team for Coach Bickey, and both my mom and dad were students at Montgomery College, and so this place is very near and dear to my heart. And
Yes, I've heard you say that you wouldn't be here if
That's
it were
right.
not for
I owe my
Montgomery.
life to Montgomery College. So
I love that. I
it's
need that on a
special
bumper
place.
sticker someplace.
That's
That is
right.
pretty awesome.
Yeah.
So here's the other thing is, one of the things I think you talk about being present, and this idea of also, I think, a balance.
Yeah.
And how to take care of be there for your family, be there for
Yeah.
your wife, be there for everybody.
Yeah.
How are you in wellness, because I know this is
Yes.
something that's very important to you. We've
Yes.
talked about this before. In addition to putting it on your schedule, do you have any rituals or certain things you just simply say, I'm going to do or I'm not going to do?
You know, a couple things actually. Faith plays an important part of my life, and it's more like it's like a form of meditation.
Yes, it is.
That spiritual connection sort of grounds me in a lot of ways, and is really important. I don't talk about it often, but it is something that plays a vital role in my
But
life
you
and
live
my
it.
family's.
You can feel it being
Yeah,
with you.
and I do try to exercise.
Yes.
So I did join a spin class.
Oh, boy.
Went this morning.
for
yeah,
you.
so
Good for
I
you.
want to try to keep that going. We'll see how that. Check back in March
I
if
will.
I'm still going.
Good for you.
But so far so good, and I think finding that time will help you be able to, you know, just be a better professional, be a better friend, be a better family member. All those things are so critical.
I love your energy. It's amazing to spend time, because I can feel
Yeah.
that just standing next to you, just let alone your agenda of what you try to do and the way you carry yourself as a council member. I
Oh,
just
thank
really,
you.
I
Well, it
really
goes both
appreciate
ways.
that. Thank
Yeah,
you.
yeah.
Anything that I didn't ask you that you would have liked to have shared?
You know, I think that we're in great shape in the county. You know, we often focus on the negative. We often focus on what's wrong with the county, but there's so much right. And things like Montgomery College give me a lot of hope for our future, because I know that we have these incredible institutions, and we're going through a pretty tough time nationally right now and internationally. And one of the toughest times, certainly in my lifetime. And I think this feeling of hope is something that we have to bring back, because it's all around us. We just have to take better advantage of it. So better days are ahead, and the county's in great shape, and it's going to be even better.
This idea of abundance, those of you who know me, I've spent some time thinking a lot about this and how you choose to see life, how you choose to approach it, and this idea to live in a county that lives its values out loud. I say that all the time. The investment we make in education, in our community, the way that we try to help each other, how we try to make sure that no one is left behind. That's a reason to live here. And because we have phenomenal elected officials who work on behalf of us, on behalf of this college, and certainly on behalf of the students and communities that we serve. Thank you so much for joining us for this, and look forward to our next one, which we'll be doing next week with another council member. But more importantly, if you have any questions next time, let us know, and look forward to being with you. All things being said, be well.